You're Getting Loud with H. Vidal, and it's time for that small business spotlight. I had to bring her back, y'all, because she has just got so many things to offer, so many services, and so much knowledge. And I would be selling you guys short if I did not bring her back because, like I said, she's got a lot of information. So please help me welcome Miss Tabetha Super. How you doing?
Good. How are you doing today?
Awesome. So welcome. Before I get started, a little bird flew on my shoulder and said, you have some news?
Yes, I am currently pregnant.
Congratulations.
Yeah, thank you.
Oh my gosh, she about to be somebody's mama, y'all. You hear that?
So excited.
So when you came back the last time, we talked about just the basics of your business, just a general overview of the business. I want to talk about something a little bit more specific today. But before we get into that, give everybody just a brief overview of Dr. Super's House of Health.
Yeah, so we are a holistic healthcare office that focuses in chiropractic care and different types of massage techniques like myofascial massage, lymphatic, including Reiki, deep tissue, soft tissue sessions, whatever your body needs to feel better. We look to provide that. And we recently just added a clear light infrared sauna with chromotherapy, so light therapy. And a lot of our patients have been using that and just feeling really, really good.
I got to get over there and try that because I've tried that before at another establishment here in Berks County, and it's so effective.
Yeah, it really does make you feel really good. And as soon as we got one, I found out I was pregnant and I can't bake a baby. So now I have to wait like a year to try my own sauna.
You're not baking no babies.
No bacon, no babies.
So what did you want to talk about today? I kind of have an idea, but I can't pronounce it.
Oh, the pathogenesis versus salutogenesis.
Yeah, that part.
Yes.
Break it down.
Yeah, so a lot of people, when I see them as a new patient and they'll ask, what do you have to do to become a chiropractor? I'm like, everything your family doctor has to do and more. And there is this misconception that we're not educated because we're separate from the rest of the medical field. But really, that's just because we have a difference in philosophy. So I like to explain that to patients because then it helps them realize what our goals are and if they match what the patient's goal is. So pathogenesis is a type of philosophy that allopathic medicine or your family doctor usually is taught in school, which is about finding the origin of disease or sickness and then trying to treat those symptoms or origin of the disease. Salutogenesis is about focusing on what makes somebody healthy, and if you're not healthy, why, and trying to get to the bottom of what makes you a healthy person and what do you need to be healthy instead of focusing on the disease or the pain. So the way that you treat a patient can be really different. Instead of me asking a patient every day, how bad is your pain? What is it keeping you from doing? And having a lot of the focus on the negative component, we change our language to, well, what have you noticed has improved since last time?
Right.
What can you do differently you weren't able to do before? How much less pain do you have if we talk about pain at all? But we're more focused on the positive component of it and getting people's brains to switch from staying stuck in a chronic pain and spasm pathway or being stuck in an illness mindset to switching into a healthy wellness mindset.
As it pertains to those two, what have you found were your biggest challenges? Like when a patient comes in, have you had like a really challenging situation that kind of occurred? Obviously, due to HIPAA laws, you can't really talk about who it is, but I was just curious about that.
A lot of times, if you have somebody who is in really chronic pain, especially for a long period of time, they're going to do one of two things. They're either sick and tired of being sick and tired,
right,
and they want to feel better, and they want to just put in the effort to be healthy. You have other people who are just looking for a miracle thing where they expect you to have one visit and fix 26 years of chronic pain. And then, they come at the second visit and go, well, it felt good for a couple days, but I still have pain. You're a big dumb idiot. And I'm like, that's not fair. You can't fix 26 years of, shoulder and neck pain.
They really call you a big dumb idiot?
Oh, worse. That was the polite thing. The patient's son I see and his whole family, and they're in love with me. And so, the grandparent came in and was like, the only reason I came to see you is because they think you're God or something, and you fixed everything that's wrong with them, but I just don't believe in this crap. And then she left. And I was like, well, when you're ready to feel better, I will be here. But sometimes you're just attached to how you feel, or you're not ready or willing to put the work in yet. So
I think that's so dope that you have that ability and that compassion to really connect with all of your patients, because a lot of people don't do it that way. They don't even have that type of mindset. You know, they just kind of go by the book and ask you those basic questions, and there's no compassion. So I applaud you for that.
Yeah, thank you. I think being a chronic pain patient makes you behave as a practitioner differently.
Right.
Like a car accident that I was in 2021. I had other injuries before that, and I've had pain before that, but everything was able to be fixed or treated with physical therapy. And this injury now, since 2021, it's just not getting better. It's not improving. Without, surgical procedures in my neck or my back, they pretty much just said, this is as good as it's going to get, and it's probably just going to get worse if you don't take care of yourself. So I have to focus on staying well and staying as healthy as I can, and not focusing on how uncomfortable I'm in or how uncomfortable I am. Or what I can't do anymore. I just look at, well, these are the things that I can do, and I want to keep doing them as much as possible.
And I never asked you this. Is that what inspired you to become a chiropractor? Was it that accident? Like I never took the time to ask. Yeah. Let's hear it.
Yeah. So I had heard about chiropractors growing up, but was never taken to one. I was always told they like crack your bones, or people have to go back 100,000 times, and really people do that because they like their chiropractor, and their chiropractor can do a lot, so they continue to go. But I was never taught to go to one, and I got offered a rugby scholarship to go to this chiropractic school in Davenport, Iowa.
You played rugby?
Oh, yes.
Oh, I bet you was a badass.
I was a little bit of a psycho. I really liked it. If I could play still, I would absolutely do it. I used to say that I would give my firstborn child to Rumpelstiltskin if I could play one more game. But I'm not doing that anymore. I'm like, no, Rumpelstiltskin, I'll keep my baby. That's fine.
Right.
But I was willing to die playing rugby. And after a brain injury, I decided, I'm going to stop. Getting kicked in the back of the head really hard wasn't great.
That'll do it.
Yeah. So when I got a scholarship to go play rugby there, I've never been to a university or a college where it's all one major. So I knew it was a healthcare school. I knew they had chiropractic. I knew that they had a couple other programs. So I figured when I got there, I would figure out what courses I would do, maybe physical therapy, maybe something else. I was a pre-med student before, so I could kind of just do whatever I wanted. And then I'd go up to the office to see if I could sign up for some classes and see what their programs are. And they went, oh, honey, you're already in all your classes. Like, here's your schedule. And I said, what am I taking? And they're like, you're in the chiropractic program. You're going to be a chiropractor. I was like, yes, I am. Thank you for my schedule. I've never seen a chiropractor. I don't even know what they do.
Wow.
So I kind of got thrust into it. But when I had my first adjustment, I have a blog post about it on our website, the adjustment that shook me, because it was the first time somebody, paid attention to what my body was actually experiencing and listened to me and didn't say that I was just anxious or making it up for attention. The first adjustment that I had was double occiput. And
what is that?
Because I got punted in the back of the head.
Okay.
My head wasn't on my spine correctly, and it was compressing my cerebellum. So I had a lot of balance issues. I had a lot of post-concussive symptoms. I had a lot of chronic pain, neck pain, shoulder pain. But when I had this adjustment, it was like a shiver went down my whole body, and I had no pain for the first time in my memory. And I sobbed uncontrollably because I didn't realize how much pain I was in until it went away. And I also had this big emotional release, because when your spinal cord is compressed like that, we talked last time a little bit about how it affects your mental health. And so I wasn't able to experience feelings or emotions for quite some time. I just felt like a robot. You can't make me cry, you can't make me angry, you can't make me happy, you can't make me nothing. But all of a sudden I had all of these feelings. And I was like, why am I leaking from my eyes? How do I stop crying? And my chiropractor said, well, now your parasympathetic nervous system can function, which is the part of your brain that can do rest and digest and focus on how you're feeling. When's the last time you cried? And I was like, 10 years ago? I don't know. So it was time to cry, and it was like a half hour in his office. Poor guy had to cancel his next 2 appointments because I couldn't stop crying.
Let it all out.
I let it all out. And then, of course, I still had some discomfort or pain came back, but it was a slow, steady improvement to getting to be healthy again. I realized, okay, my body was worse off than I thought it was. I had played a lot of rugby professionally for a while, traveling around and doing stuff with some, pro sevens teams. And
wow, you was nice like that?
I broke both my wrists at the same time once, and for 3 months just taped my hands together and kept playing all summer because I was addicted. I said I was ready to go anytime playing that sport.
I bet you could fight fight. You could fight, can't you? You look like you could fight.
Didn't have a game. I didn't get a fight in. But I never got caught. I never got carded.
You look like you look like you got some hands.
Very sneaky, very fast. But I was pretty quick. So my goal was just to avoid as much contact as possible. But I also loved delivering contact. So I was originally taught to tackle incorrectly, which is why I had so many head injuries to begin with. But then when I was with different coaches who taught me how to deliver an impact instead of absorbing an impact, then I was great. I didn't have, any issues with tackling or absorbing a tackle or delivering a tackle. But up to that point, I had done so much damage that it needed to be fixed before I could play again. So after I started feeling better, getting chiropractic care, I snuck over to University of Iowa and played for them a bit. And they were like, wow, they nicknamed me the Honey Badger. They made up an award called the Honey Badger Award because it would just be like I would get up, tackle somebody, get up, tackle somebody, get up, tackle somebody before anybody else could get there. And they're like, you're just a psycho. We don't know how you do that. And I was like, tackling's my favorite. Like, if nobody else is there, I'm going to do it.
The Honey Badger.
The Honey Badger Award. My favorite award.
I will now call you Dr. Honey Badger.
The Honey Badger.
The Honey Badger.
Yeah.
Anything else you want to tell the listeners? Like, do you have any specials coming up going into like the end of the year?
Yeah, so we at our office focus a lot on philanthropy. To me, it's really important, especially not having access to healthcare for prolonged periods of my life. We do these free care days. So on October 14th, on Saturday from 10 to 3 is our next free care day. Okay. We do accept donations for care, and we use them either for different fundraisers we're doing for other groups in the area or nonprofits, or sometimes if we need to like update stuff, like we want to get some more equipment to do more detailed stuff with patients. All of it goes towards that, or funding different things in the office or outside of the office with those organizations. But it's like 10-minute chair massages and chiropractic adjustments for free or by donation. And it doesn't need to be anybody that is a patient at our office. It can just be anybody walking off the street. So we've had some people that are unhoused like come in and get care or get a physical or a checkup. People who just can't afford a new patient exam fee and they just want to, go through and make sure that they, are aligned or that they can get some type of care. And we usually do them a few times a year. So that next one is on October 14th.
All right. And that's going to be at the office, 2209 Quarry Drive?
Yes. Yep.
And it's Suite B21. B21. I almost said B12, like the vitamin.
Oh, the vitamins. Yeah, those are good. Take those.
Yeah, I do. And that's in West Lawn, guys. So make sure you guys stop by. If you've never been to Dr. Super's House of Health, I encourage you to stop by. In fact, I have an appointment tomorrow.
Yes, you do.
Yes.
I was like, oh, yay, Hamilton's coming.
Yep. So I get chiropractic care by Dr. Flame, and Bree is my massage therapist. She's doing a stretch session with me tomorrow because I work out like a crazy man.
Yeah, I got to get some stretching in.
So yeah, I make sure that I, implement that self-care. It's very important, guys. If you have not seen a chiropractor or gotten that LMT, I highly, highly encourage you to go see Dr. Super's House of Health. They're located at 2209 Quarry Drive, Suite B21 in West Lawn, Pennsylvania. Thank you so much for stopping by.
Yeah, thank you for having me.
I'm going to bring you back next month. What are we going to talk about?
Ooh, whatever you want. There's so many things.
You know what I'd like to do?
Yeah. No, I don't.
I think we should bring Bree in.
Oh, that would be fun.
I would like to have you and Bree in here, and we'll talk about LMT.
She's usually done around the same time as me on Tuesdays, so we can do that.
Stay tuned for the next episode. We're going to have Dr. Super and Bree Quigley, my LMT. Thank you again.
Yeah, thank you.